I welcome those members' support for government welfare reforms.
Question number 12, Barbara Stewart.
Thank you, Mr Speaker. My question is to the Minister of Health and asks, is he satisfied that New Zealand's maternity services are meeting the needs of pregnant women in New Zealand? If not, why not?
The Honourable Joe Goodhue.
Mr Speaker, on behalf of the Minister of Health, it is important to state that the phrase meeting all the needs sets a very broad parameter. There is no definitive list of needs. What I can, however, say is that New Zealand has a world-class maternity system, but we can always do better. From time to time, service to an individual may fall short of that required, sometimes with tragic consequences. That's why doctors, midwives, nurses and other health professionals across all 20 DHBs are now all working together for the first time ever on the National Maternity Quality and Safety Programme. We want the best possible services to protect the safety of mothers and babies, and that's why the National Government has invested $114 million over the last 4 years into improving safety and quality.
Barbara Stewart.
Thank you, Mr Speaker. How can he be satisfied with maternity services when there were 21 infant deaths in 2010, where midwives failed to follow best practice guidelines, including the case where Hastings coroner Chris Davenport last Thursday said texting was an inappropriate way for midwives to complete clinical assessments, which resulted in the death of a baby boy last June?
The Honourable Joe Goodhue.
Thank you, Mr Speaker. On behalf of the Minister, each tragic circumstance is reviewed, and each tragic circumstance where a mother or a baby dies gives the opportunity for the individuals involved to learn from the review process. Ideally, these tragic circumstances would never happen. But the National Maternity Quality and Safety Programme gives us a new opportunity to not wait for tragic circumstances, to actually move forward and improve the quality and safety of the care that's provided to mothers and babies in New Zealand.
Barbara Stewart.
Thank you, Mr Speaker. Is he aware that 96 to 98% of midwife graduates undertake the additional midwifery first year of practice program? And if so, will he make completion of this program compulsory to ensure some consistency across the sector?
The Honourable Joe Goodhue.
Mr Speaker, on behalf of the Minister, I'm afraid I'm unable to answer that question, given that I have not been briefed on the hypothetical question going to the Minister.
And that brings to a close questions for oral answer. I call on Government Order of the Day number 1.